Are you a follower of PR's neuroscience? You are going through so much of videos regarding port spine. So today also we are discussing about some secondary complication that we can expect after port spine. So before coming to the secondary complications, we will give a brief idea regarding what is port spine. You can port spine is commonly is popular as tuberculosis spine or TB spine. So whether the TB is spread to brain or central nervous system, there will cause some kind of cavitations over there. Whether it comes to spine, it will cause TB spine. So usually when we take an X-ray of a patient who is having that TB or port spine or any other tuberculosis, we will see a cavitation over there. So just imagine this cavitation is sitting in the vertebral column or the spinal canal. So because of that cavitation, we are having all these problems. So usually what are the secondary complications we are expecting after a port spine is, first one is deformity, we will expect. Second one is there is a chance of getting abscess or severe infections. Third one we are expecting paraplegia. Then we will come to deformity. Once the TB spine is there or the cavitation is present there, it will cause us degeneration of the vertebral column or the bones over there. So it will cause us kyphotic kind of postures for the patients. So usually when the patient is having this TB spine, there will be an angle of 10 to 20 degree of kyphotic angle will be there for certain patients. So if you ask me whether it's coming back to normal or it's rehabable, yeah, up to an extent it is rehabable, but the degeneration caused by the degeneration of the bone is not completely rehabable. So still after curing the diseases to 5 to 10 degrees of kyphotic angle will persist. Then coming to abscess, we can see that abscess is nothing but the accumulation of pus. So you can see certain patients with having severe redness, severe open lesions in the body after TB spine. So it's mainly because of the pus accumulation. As we all know, tuberculosis is an infection of Mycobacterium tuberculum. So there is a infection. So that infection will spread out. So that will cause the abscess accumulation over there. Then coming to paraplegia, if all these incidents are happening just beside the spinal cord, so once the bone got degenerated or the abscess is compressing the spinal cord, at what level the compression is happened, based on that thing, the neurological deficit will come. Just imagine, usually we'll see the tuberculosis accumulation or the cavitation mainly in thoracic level. So usually we are expecting as a neurological deficit is paraplegia. Below the level of injury or below the level of compression, we will not feel any kind of motor sensations. Sensory might be okay for some patients, but there are certain patients who is having both sensory and motor deficits. So they have to live rest of their life like paraplegic. It's rehabable. They have to, but the neurological deficit is also a very risky for all the patients who are having tuberculosis. If you are interested to see most of the videos like this, informative videos like this, you can subscribe our channel over there.